name is Tejas Patel, and I'm a software engineer intern at Omega Consulting. Today, I'll be talking about digital healthcare. During this presentation, I'll be covering the overview, the importance, the benefits, and the future of digital healthcare. So, what even is digital healthcare? Digital healthcare is the convergence of digital technologies within the healthcare field. I believe that new technologies emerging from digital healthcare will revolutionize the world. Let me start off by mentioning a statistic from the Centers for Disease Control. The CDC has reported that 900,000 Americans die prematurely from the five leading causes of death, which include heart disease, cancer, chronic lower respiratory diseases, stroke, and unintentional injuries. Wouldn't it be incredible if every American was able to afford healthcare, and we would see this number dwindle down to zero? Politicians right now are trying to solve the problem of affordable healthcare. Healthcare professions, Healthcare professionals are also continuously working on new technologies that will revolutionize our healthcare industry. Soon, this field will not only rapidly improve the diagnoses and treatment of chronic diseases, but as well as to help patients in a multitude of ways, including vastly improving their physical and mental health. This will eventually lead to a very affordable and accessible healthcare plan in which many people may not have access to otherwise. As we progress through this presentation, we'll be discussing the three primary benefits of digital healthcare. As the technology advances in the healthcare industry, the quality of healthcare is said to dramatically increase as well. Healthcare will soon be more easily accessible and different health conditions will be managed more efficiently. In order to recognize the quality of healthcare is changing, we must look at the quantitative change from point A to point B. But what does quality even look like in the healthcare field? The Institute of Medicine defines healthcare quality as the degree to which healthcare services for individuals and populations increase the likelihood of desired health outcomes are consistent with the current professional knowledge. One statistic that can be used to hint uh, to the overall quality of healthcare being improved is that in more modern times, humans are living much longer. On average, the life expectancy increased from less than 40 years to over 72 years over a 200-year lifespan. This dramatically increase in life expectancy can be attributed to rises of new technologies as we enter a new age of technological advances. The quality of healthcare will further increase. As we take a closer look at this graph, we can see that the life expectancy has almost doubled in the past several decades. The reason why the US is ahead of the rest of the world in life expectancy is mostly due for them being a more developed nation and having more of a developed healthcare system. In the first half of 2020, about 43% of US adults ages 19 to 64 were inadequately assured. This is partly due to the fact that healthcare is just so expensive in America and might be inaccessible for a majority of the population. New digital healthcare technologies try to resolve this by lowering the financial burden on healthcare professionals as well as expanding their reach. This is especially important for patients located in rural areas or for patients in which it is difficult for them to travel. With high performing technologies in their pockets, patients are easily equipped to provide their health information to the physician at any given time. One major upside is that new technologies help patients manage their health conditions much more efficiently. Most importantly, it can be used as a tool for early detection for a life threatening disease. Approximately 42,000 adults and 300 children in the United States die each year from vaccine preventable diseases. This is why it's so beneficial that many people are able to detect these diseases before they become irreversible. As we become more technologically advanced, the healthcare sector will prosper proportionally to it. The most popular fields of digital healthcare technologies include wearable devices, 3D bioprinting, artificial intelligence, telemedicine, and augmented and virtual reality. In the future, tons of data will be collected and will provide more information for individuals. This will give rise to various wearable devices. Wearable devices will uphold the great promises by bringing personalized information and health risk related tracking for all users. In healthcare, 3D bioprinting is used to create tissue or living human cells. This technology will be the key for patients who need additional organs or limbs. Given all the data healthcare professionals will possess in the future, it's inevitable that artificial intelligence will soon help healthcare professionals in ways that they could never imagine. More focused on the present, we have telemedicine, which is how physicians treat patients remotely. Also, in terms of digitalized treatment, augmented and virtual reality can create different situations for patients that can be repeated and tailored to treat many conditions. We are now only seeing a few of these technologies being used by various startups. But as time goes on, the digital healthcare field will soon be revolutionized. Wearable devices come in a variety of forms, including smartwatches, smart glasses, smart helmets, and many more. In some cases, people can implement devices in their body. Many of these devices record different data points such as calories burned, body mass index, and heart rate. Beyond the scope of these wearables, researchers are developing smart related bodywear such as clothing, patches, and other accessories to deliver an on demand drug release. This technology will have the ability to expand into smart implants in both severe and non severe cases. These types of technologies are used to collect data points on patients at all times. Since it is no longer necessary to have patients come into the office because their doctors will already have the necessary data. This data can lead to better treatment as well. Doctors will soon have a better insight on how a certain medication is performing. The market research firm ID Tech EX has projected that the wearable device market will reach $100 billion by 2023. It is estimated that wearables among adults are projected to grow from 18.1% in 2017 to 25.3% by 2023. In 2019, 3.8 million American children and teens have owned a wearable device. 38% of wearable users are in the ages of 25 and 34, and 13.2% of users are between 55 and 64. Also, just over half of the American population are routinely wearing a smartwatch. By 2021, 16% of all wearable devices will be smartwatches, and 30% of smartwatch unit shipments will be smartphones designed specifically for children. By 2022, 28.9 million millennials will have owned a wearable device, and 25.5 million will use a wearable at least once a month. 3D bioprinting is the creation of living tissue such as bone, blood vessels, and hearts. It is known that some innovations are truly in their infancy stage, but the core of 3D bioprinting promises some truly great achievements. The 3D bioprinting market size was valued at $1.2 billion in 2019 and is expected to grow at a compound annual growth rate of 17.4% from 2020 to 2027. The growth of this market is attributed to a limited number of organ donors and an increasing age population with chronic respiratory diseases. 3D bioprinting is witnessing demand on a large scale with the increasing spread of COVID 19. Stratanus, which is one of the leading manufacturers of 3D printers in America, have manufactured face shields with the help of a 3D bioprinter. As of March 2020, they have shipped about a million face shields in the US. There's also ongoing research on the development of 3D printed hearts and other organs. According to the United Kingdom National Health Services, 429 patients have died in 2014 in the UK while being on the wait list for an organ transplant, 38 of which were waiting for a heart transplant. What a horrible reality it is that a patient who needs an organ transplant either has to wait for someone alive or dead to donate. The future of 3D bioprinting will soon solve this issue. The global artificial intelligence in the healthcare market size was valued at $2.5 billion in 2018 and is expected to grow 41.5% from 2019 to 2025. The growing need for lowering healthcare costs, growing importance of big data in healthcare, rising adaptation of precision medicine, and declining hardware costs are some factors driving growth. Artificial intelligence has the potential to completely change healthcare as we see it today. Complex algorithms are able to design treatment plans, create drugs, or mine medical records way faster than any medical professional can. The company Atomwise uses supercomputers to compute complex mathematical problems in order to run their AI algorithms more efficiently. In 2015, they launched a search for safe and existing medicines that could be redesigned to treat the Ebola virus. The company's AI technology predicted two particular drugs by which they have significantly reduced the Ebola outbreak. Also, Google's DeepMind has created an AI algorithm for breast cancer detection. The algorithm outperformed all human radiologists on pre-existing datasets to identify breast cancer among different women, on average by about 50, by on average by about 11.5%. These two examples are just the tip of the iceberg when it comes to using AI to advance healthcare. Telemedicine is known to be one of the most broadest topics of digital health. It encompasses the digitalization of medical records, appointment bookings, remote care, self-symptom checkers, and many others. The use of telehealth has expanded exponentially since the late 1990s, and current projections indicate that it will occupy $30 billion of the healthcare market by 2020, an increase of $20.4 billion since 2013. Among rural Medicare recipients alone, the number of telemedicine visits increased from just over 7,000 in 2004 to nearly 108,000 in 2013. Due to the recent COVID-19 pandemic, healthcare professionals saw a rise of patients booking non-urgent consultations with their doctors. According to the Journal of the American Informatics Association, virtual urgent care visits at NYU Health grew by 683%, and non-urgent virtual care visits grew by a staggering 4,345% between March 2nd and April 14th of 2020. This type of treatment is becoming one of the primary ways doctors are seeing their patients and has been being proven successful. This type of digitalization interaction keeps both parties safe and is a reliable way that physicians plan to use routine checks even after the pandemic ends. Telemedicine also displays online health records for both the patient and the doctor. They both have access to the relevant information at all times if a situation would ever arise. This means that the patient's data is more readily accessible to healthcare professionals and can be analyzed more, leading to, leading to a better and smarter treatment plan for the patient. This carves the path for a more personalized healthcare system in which patients can better understand their conditions and could result in a more positive outcome. The global augmented and virtual reality, short for AR and VR respectively, in healthcare was valued at 500, $568.7 million in 2016 and is projected to grow at a rate of 29.1% from 2016 to 2025. AR and VR can be both thought of as two different technologies. With AR, the user will not fall out of touch with reality and display information in their environment in real time. These technologies have revolutionized the healthcare industry with their adaptation in virtual training of of surgeons for difficult surgeries, 3D operate 3D operating room simulations, phobia buster in mental health treatment, and chronic pain management. VR technology has also played a significant role in eye movement desensitization and reprocessing therapy that enables to reframe traumatic memories through eye movements. In addition, this technology also benefits in other areas of care management, including autism, cancer, and depression therapy, and assisted living. VR organ VR-based organ models have played a crucial role in preparing surgeons for delicate and complicated operations that demand greater precision, less complication, and reduced trauma. As we talked about the different benefits of digital healthcare that it provides, as well as the soon to be implemented technologies as a whole, we still have a long way to go to realize its full potential. Before the COVID-19 pandemic, some of these technologies, such as wearable devices, 3D bioprinting, artificial intelligence, telemedicine, augmented reality, and virtual reality, would have taken forever to actually come into the industry. But that is not the case for some now. Many healthcare companies are being created and are working to solve this issue we are seeing today. Some companies, including Babylon Health, whose mission is to put an accessible and affordable healthcare service in the hands of everyone on earth. By utilizing the right tools, the technology can reduce costs, increase operational efficiencies, and improve patient outcomes, all while building a system that benefits consumers and providers alike. Hopefully, in the nearby future, we can live in a world where healthcare professionals are able to eradicate chronic diseases and provide affordable and accessible healthcare for all.